Welcome back to Daytime Ottawa. You know, throughout this pandemic, we have seen some of our most vulnerable within palliative care, within long-term care, unfortunately succumbing to COVID-19. And we've seen death and dying like I don't think we'd ever seen before in this country and around the world. And here to talk more about that, I am joined by the CEO of the Canadian Hospice Palliative Care Association, Laurel Gillespie. Welcome to the show, Laurel. And yeah, let's speak on that, Laurel, because I think it opened our eyes and shone a light on how vulnerable our, aging population really is in, not only in Canada, but around the world, right?
Yeah, for sure. Thank you for having me today, Derek. I suffice to say that loss is difficult at any time for anyone. And grief is a universal response, natural response to loss. But what we've seen happen, particularly in Canada and the travesties of what happened in the long-term care setting, is that people's most basic needs were not being met. And we had capacity issues with training and numbers and standardizations when it came to, our aging population and whatnot. And COVID, unfortunately, brought that to light. And with our grieving, it's very natural, but we all grieve very differently. And I think it just came as a sudden shock to our systems that we had not ever experienced anything like this. And it wasn't just affecting, the families of the loved ones who were dying. It was also having a very extreme effect and impact on those who were working front line, because when, they would lose one patient, let's say in a week, now suddenly they were losing 17. How did even the clinical staff cope with that? And we learned quite a bit out of SARS, but it certainly wasn't a priority enough to be prepared fully for what we were going to be faced with, particularly March 2020.
Laurel, so, is there a positive? I mean, you touched on it just briefly there. Is there a positive that have come out of this situation, this pandemic?
Well, I'm really hopeful that there is. And I know you can probably see behind me my ducks that are in a row.
Yeah.
And I think that there's a process that's called advanced care planning. And it's about being able to identify a substitute decision maker for you in the event that you're not able to speak for yourself. It can become very complicated, though, because we have 13 different jurisdictional processes that we have to follow in Canada because our healthcare system, the way it's delivered,
right.
Legislatively, there's many differences. But the one thing I think that I'm hopeful is that people will become more aware of the process of advanced care planning, of designating someone to speak for you when you're not able to speak for yourself, so that your wishes and your values, your beliefs, the things that are most important to you and the decisions that you can make for yourself will be carried through and honored.
Laurel, the UK has declared palliative care a human right. We haven't seen that here in Canada. Why do you think that is?
Well, it's, it's very complicated. It's coming from the World Health Organization, a global initiative that's spearheaded through the World Health Organization. We do a really good job, I think, in healthcare at bringing people into the world. Our hospitals do a phenomenal job at making people well. We do a terrible job at helping people die. And a palliative approach to care is not universally accessible in Canada. And in fact, 30% of people who are dying don't have access to any palliative care at all. So for me, the process of end-of-life care and a palliative care approach is one that really comes down to the fact that it's a fundamental human right, that everyone should have the ability to die in a dignified way and have the right supports at the right time and in the right place.
Laurel, as a national voice of this movement, and I believe it is a movement because of everything that you've described, what do you need?
Oh, what do I need? I need for the National Palliative Care Framework to be fully implemented that was introduced by the federal government in 2018. And I worked very, very hard at trying to further that advancement and working collaboratively with other national organizations to see that come to fruition. My goal as the leader of this organization and the voice of palliative care in Canada is that I would like to see that regardless of where you live, in this country of your postal code that you would have access to quality, accessible palliative care when you need it.
I can't thank you enough, because I think, sitting and watching, just the fact that we brought in the Canadian forces into long-term care homes, I hate to get emotional, but, I have a father who, is having his own difficulties, and we're so fortunate to have him having home care. And, I just felt so fortunate that I didn't find him in a place like that where you had to bring in people like the Canadian Armed Forces. Laurel, thanks so much for joining us. Really appreciate your time today. Don't go anywhere. We'll be back with more Daytime Ottawa right after this.